uneducated progressives, and gentlemen. Today I'm going to try to make this fairly quick. Video on why American healthcare costs are so high, and I'm going to focus on basically two issues. The percentage of all healthcare spending, and all the relevant links will be underneath the video as usual, as I always cite my sources. We're going to go over the percentage of all healthcare spending that is taken care of by government, various government programs like Medicaid, Medicare, and S-CHIP and all that, and what percentage of it is out of pocket. It's very important, as you'll see the percentage of healthcare expenditures that are, well, overall that are third party are ridiculously high. It's well over 80%. You'll see, it's well over 85% today, actually, the percentage of healthcare spending that is not third party. And then if you look at third party government payments, that has also absolutely skyrocketed over the last 40 plus years. Lee Doran did a video on that that focused on the third party problem, and that's very important. I'm going to delve into it just a little bit more. So we look at national health expenditures by type of service and source of funds. Out-of-pocket spending as a percentage of all healthcare expenditures from 1960 to 1965. Remember, this is prior to Medicare and Medicaid being enacted. It's also prior to S-CHIP. Over 45%, 45.01 to be exact, of all healthcare expenditures were out of pocket from 1960 to 1965. That's almost half. I bet people were going bankrupt because of medical bills. Now, granted, healthcare probably was going to increase in cost somewhat, because you've got a lot of expensive, invasive, and very dangerous procedures that can extend people's lives 10, 15 years. And then you've also got, I'm not necessarily a big fan of big pharma, but drugs were clot-busting drugs that you can take where you don't have to go under the knife, which is a lot less risky. Every time you go under the knife, there is a chance that you will die. But overall, healthcare expenditures have been above and beyond, and healthcare spending above and beyond the rate of inflation. Part of that has to do with a fiat currency. Part of it has to do with the government, And then, of course, these uneducated progressives, like Old Brown Teeth from California and his little buddy, the fake doctor from Chicago, they'll just blame insurance companies. Well, people aren't most of this it's not a free market. It's become completely third-party regulated. So there you go, 45%, 1960 to 1965. Over 45% of all healthcare spending was out of pocket. 1966 through 69, it had fallen to 36.35%, and that was Medicare did exist then. It had started up in 1966, so you can see it's already having an impact. And another reason it had an impact is state mandates for health care coverage, especially in the 1970s, really started to get cranked up. Where if you offered health insurance in a certain state, and some states are worse than others, if you offer health insurance there, you have to cover this, this, and this, and this, and this. And they have just piled on thousands of mandates, as you will see. 1970 through 1979, out-of-pocket spending was 28.49% of all healthcare expenditures, dropping rapidly. 1980 through 1989, it had fallen to 21.4%. We do have a trend, folks. Out-of-pocket spending as a percentage of all healthcare expenditures, 1990 through 1999, a paltry 15.63%. The rest is third party. And for the period 2000 and 2011, out-of-pocket spending as a percentage of all healthcare expenditures was only 12.74%. I have mentioned that in other videos. I just didn't get into it in depth. So that's a huge problem. You can see we have a trend, a disturbing trend. And then we're going to look at Medicare, Medicaid, and S-CHIP. And I did edit the document to bring everything together, so total national healthcare expenditures could be the column right above it. So if we add Medicare and then federal and state local spending attached to, or Medicaid, and add that with Medicare, and then S-CHIP, which was passed by a very a very conservative Republican Congress under Bill Clinton, because the Republicans are very conservative, and they don't like socialized medicine, and they don't spend big sums of money. Oh wait, they do. So we're going to add all those federal programs together, and as a percentage of healthcare expenditures. So all those programs combined were only 0.75% of all healthcare expenditures, 1960 through 1969. I remember a very uneducated progressive was on one of McStupid's videos claiming that Medicaid and Medicare extended life expectancy. Well, it didn't really, because there was no spending connected to it in the 1960s, and from 1950 to the end of the 60s and even the end of the 70s, life expectancy was already growing at a pretty good clip. 1970 through 1979, the average for all those government programs was only 2.99%. 2.99% is all, adding Medicare, Medicaid, and S-CHIP. 2.99%. So less than 3% of all healthcare spending was government back then. The 2000 to 2011 average for those same government programs, I just jumped ahead to that, 48.43%, a stark trajectory over all time frames towards more government control, more government red tape, and more government spending in healthcare, and more importantly, all third party payments. And quickly, I'm just going to put up all the numbers, the exact numbers I went through, just so you can see those for every year. 1960 through 65 out-of-pocket spending prior to Medicare, Medicaid, and then I went through that. I've already been through this, but here it was on the year-by-year basis. So you can just look at that real quick. And there it is for Medicare, Medicaid, and S-CHIP. And as you can see, in 2009, 2010, and 2011, over half of all healthcare expenditures were government programs. 2009, 2010, 2011. It's going to continue to go up. So, and that's the plan. That's the progressive plan, and even the Republican plan in many cases. So now we're going to get to the second part, the number of state mandates. So if a health insurer, this contributed to the third-party problem even before government payments started really taking over the system. Where while mandates, and this is from the Council for Affordable Health Insurance, while mandates make insurance more comprehensive, they also make it more expensive because mandates require insurers to pay for care customers previously funded out of their own pockets. It's like, if you want to spend more on something, or you want to see more demand for something, I should say, just to mandate that it be free, with, in quotes. We estimate that mandated benefits currently increase the cost of basic health care coverage from a little less than 20% to more than 50%, depending, and that's the important part, depending on the state and its mandates. By the late 1960s, listen people, state legislatures had passed only a handful of mandated benefits. Today, we've identified 1,000, this is 2008, mind you, 1,961 mandated benefits and providers. So we're almost 2,000. So if you offer health care insurance in a state, some states are worse than others. Just because one state has more mandates doesn't mean it's going to be more expensive, although if you pile on us 40 or so mandates that increase the cost of health insurance by 1%, if you add a few that are very expensive, like, say, mental health parity and alcohol and drug abuse counseling, add a few that are very expensive, you don't have to add a whole few. But if insurance is required to cover the provider, it must pay for the service provided. So, I got in an argument with a lady once, and she said, "You don't think mammograms should be covered? That's terrible that you don't think." No, I'm not saying women can't get mammograms. I'm just saying it shouldn't be mandated for coverage because it doesn't do me any good. Smoking cessation doesn't do me any good, mandating that for coverage. Alcohol and drug abuse counseling doesn't do me any good because I'm not going to use it. In vitro fertilization, mandating that for coverage doesn't do me any good because I'm not going to use it. Have the people who want it pay for it. But they increase costs for everybody, and this is part of cost shifting. We'll get to another example of cost shifting, community rating, in a moment. Mandate legislation differs from bill to bill and from state to state. For example, one state may require insurance to cover a limited number of chiropractor visits per year, while another state may require chiropractors to be covered equally with medical doctors. The second will have a greater impact on the cost of health insurance policy than the first, so it's important to read that and understand that, because people, like I've said, the main argument is, health insurance companies. And I'm not saying they're as pure as the wind-driven snow, but a lot of the uneducated here on YouTube, there's thousands and thousands of them. They use their free time. They have lots of free time, and they're on YouTube all the time saying, it's health insurance companies, and they never focus on these percentages of healthcare spending. They never focus on these mandates because they don't know. Their blogs that they copy off of don't tell them. Some mandates have a much greater impact on the cost of health insurance than others. For example, mental health parity mandates, which I think a lot of people on here need. You don't need a mandate, but you need mental health care. You need to see psychiatrists, which require insurers to cover mental health care at the same levels as physical health care, have a much greater impact on the cost of premiums. And if you don't use it, well, you're still going to pay for it. It's still going to result in higher premiums. Many states have 40, 50, or more mandates, although most mandates only increase the cost of a policy by less than 1%. 40 such mandates will price many people out of the market. Very important point there. Real quick, this is the 2012 report, or this is the, 2012. The total mandate count, remember what it was in 2008? It was 1,900 some. It was under 2,000. The total mandate count for the 2012 edition is 2,271, up from 2,262 in the 2011 edition. So you see, just in 4 years, the states piled on about 300 mandates. That would be the equivalent of each state adding 6. So it gets expensive. Here's what I mentioned about community rating. It's not like car insurance, where if you have a guy who's had a drunk driving conviction and 4 speeding tickets in the last 5 years, he's probably going to pay more in health insurance premiums than somebody who has no moving violations. But we don't do that with health care because we need to cost shift from the old baby boomers who are looking for a handout want to have cost shifting. Well, some of them, I shouldn't say they're not all progressives. They want the young invincibles and people middle-aged to pay for their health care, because they just need more cost shifting. And then when you factor in the fact that they're going to get more than 2.5 times out of Medicare that they paid in for, that's quite a sweet deal, baby boomers. You're going to get, some of you, not all the baby boomers. Some of those people who are retired now and at a ripe old age, that's quite a deal. You kind of won the lottery there, didn't you? The ObamaCare, which is what it is, I don't refer to anything else because it's Obamacare. The sweeping law, referring to Hussein Obamacare, also limits insurers' ability to price a policy to accurately reflect the risk an applicant brings to the pool. And of course, progressives will say, they're just evil. Now, if you smoke 3 packs of cigarettes today and you're a fat ass, 30 pounds overweight, smoking cigarettes, you're a drug abuser and an alcoholic, and you're old, your dumb ass should be paying more than somebody who's under 40 and perfectly healthy. This mandate, known as modified community rating, severely restricts the ability of plans to rate coverage based on factors such as age and gender. So that will increase everybody's premiums, whether you are healthy or not. States with the most and least mandates, real quickly. Although it'd probably be safe to say that Idaho would probably have much lower costs than Rhode Island. Although there are some mandates that are popular in almost every state. See the mammograms? There you go. Maternity minimum stay, breast reconstruction, mental health parity, which a lot of people need, and alcohol and substance abuse. They raise costs and they're really popular. Most people don't need them, but they're mandated. Then I'll just let it roll by real quick. Total mandates by state. So some states differ than others. Obviously, there's some states that I'm not surprised New Jersey's over 40. North Carolina, there's 55 there. Even Texas has a large number of mandates. There's Florida at over 50. Illinois has got almost 50, no surprise there. New Mexico is almost 60, one of the higher ones. And you got Texas there, that's over 60. That may surprise some people, may not. Maine, almost 50, no surprise there. Kentucky, almost 50. Louisiana, over 51. So it varies by state. So that's why, folks, your premiums go up every year, and healthcare spending overall, except for LASIK and elective cosmetic surgery. That's why healthcare spending is always has been for decades, increasing higher than the rate of inflation because of these mandates that have been piled on for coverage, and because it's become nothing but a third-party payer system. It is not a free market. It has not been a free market for at least a half a century. And if you think it was a free market, then you don't know what a free market is. You're either stupid or you're lying. So there's some fast facts for you, folks. Again, all the relevant links are under the video as usual. So next time you get a progressive spouting off on healthcare, you can ask them about that. Over 88%, around 88% of healthcare expenditures being third-party payments, and over half of those being government payments. That's not a free market. Have a nice day. And don't thank me now for the information.